all know by now that COVID-19 isn't going anywhere anytime soon, which is why doctors and scientists say the virus will eventually become endemic, meaning it's just a part of normal life. All right, so where do we go from here? Dr. Jeffrey Singer, General Surgeon and Senior Fellow at the CATO Institute, joining me on the show this morning. Dr. Singer, thanks for being here.
Good morning.
All right, so you recently wrote an article, and we have that here, and it really gets into two schools of thought when it comes to managing this virus, a zero-tolerance policy and harm reduction. Now, you support the latter. Tell us why that is.
Well, when it comes to zero tolerance in terms of COVID, that's trying to eradicate the virus, that keeping restrictions in place until we see virtually no cases, and that's just not realistic. This virus, like every other respiratory virus, like the influenza virus and RSV and colds, is going to become endemic. It's going to be part of us. We've only eradicated one virus in human history, and that was smallpox, and that took 200 years. And all of these restrictions carry with them trade-offs that harm people as well. And some groups of people are sometimes harmed worse than the virus harms them. So we need to focus on ways of reducing the harm the virus causes to us so that we can go on living our lives as normally as possible. The most effective way of doing that, of course, is immunization. So by vaccinating people, we're reducing the risk of spread of the virus, but we're also reducing the chances that if anybody catches the virus, they'll get very seriously ill.
Well, the Delta variant showing us just how quickly that virus can ramp back up. And now we have other mutations surfacing as we speak. With no end in sight, do you think it's possible to imagine a future without face masks?
Well, you know, we haven't been wearing face masks over the years when we get outbreaks of the flu or of bad colds or RSV. And I think that it's important to keep in mind that as more of us are getting immunized, either through vaccines or through catching the virus and then having natural immunity, which evidence is that that's as good as getting vaccinated, maybe even better. So fewer and fewer pathways have become available for the virus to spread, mutate, develop new variants. And in addition, those of us who do catch the virus and get reinfected or breakthrough infections are much less likely to get seriously ill. So I don't necessarily think so. Also, you know, there's 2 days ago, a very large randomized controlled trial came out and told us, speaking of masks, that first of all, cloth masks don't seem to have any effect, and surgical masks do have a mild effect, about an 11% reduction in your chance of getting COVID if you wear surgical masks, at least according to this very large randomized control study that came out from Bangladesh.
Oh, interesting findings there. I want to go back to a point you made earlier about the vaccines, and you stated in this article, you also said it earlier in our interview, vaccines have proven to be the most effective tool when it comes to harm reduction. But in the article, you stopped short of saying that vaccines should be required. In fact, you said vaccine mandates should be avoided. Why is that?
Well, it's hard to morally justify forcibly vaccinating someone. That's a form of physical assault. And if you try to justify it as an act of self-defense, it's even more difficult now with so many of us already either vaccinated or having natural immunity. So we're less threatened by people who might be contagious. But in addition to that, forcing someone, there's no guarantee that, number one, that person who's not vaccinated is going to get COVID and therefore threaten you. And there's also no guarantee that if you vaccinate them, they won't be the one person to have a bad reaction to the vaccine. So between all of those factors, I can't come up with a moral justification to force people to become vaccinated. I think it's immoral. On the other hand, if private individual businesses, organizations, hospitals, if they set the terms for people to do business with them or enter their facility as you need to be vaccinated, that's their moral right as well. So we can't force them to not require people to be vaccinated if they want to associate with them. That's their private personal right.
Oh, interesting there. We're running out of time here, but I do want to get to one more question. Moving forward, what's your advice to lawmakers that have to navigate the COVID legislation that will affect all of us?
Well, I think if there's anything we should have learned over these last nearly 2 years, it's that we don't know a lot, that the quote unquote science is constantly changing, because that's science. Science is constantly learning new things and revising your understanding. So they should avoid one size fits all blanket solutions that might be wrong and that are difficult and could cause harm in the process, and allow as much of the solutions to be designed on the local level based on local knowledge and where changes could be made more quickly and readily, and in real time, and understand that you should try to avoid permanent solutions, because the knowledge that we have is obviously not permanent. It's constantly changing.
Dr. Singer, great conversation. Thanks for coming on the show this morning.
Thank you for having me.